Hello, friends. Dave Bjork here, lung cancer survivor, patient advocate, and host of the Research Evangelist podcast. I recently got back from the ASCO annual meeting, which is the largest oncology conference in the world, and I'm doing a series of short interviews to provide some interesting research from ASCO for patients who could not attend. This series is supported by an unrestricted educational grant from Nuvation Bio. And today I've invited Dr. Yasir Elamin, a medical oncologist and associate professor of thoracic and head and neck medical oncology at the University of Texas MD Anderson Cancer Center, to tell us what we need to know about an abstract that he presented at ASCO. It's the patient-reported outcomes and health-related quality of life with taletrectinib in advanced ROS1 non-small cell lung cancer from the TRUST-II study. And I was honored to meet Dr. Elamin at ASCO and visit his poster session. But welcome to the program.
Thank you so much, Dave. It's great to be here.
Great to see you. So why don't we just start by telling us about the research and and then we'll get into what do patients need to know as takeaways from this. But I'd love to hear you just tell us about the research.
Excellent, Dave. Thanks a lot for bringing that important study to the light. So, one of the biggest questions in cancer treatment isn't just whether a drug shrinks tumors, it's whether patients actually feel better while taking it. That's what this study looked at. The drug, as you said, called taletrectinib, is used to treat a rare type of lung cancer driven by a ROS1 gene mutation or alteration. Previous studies have already showed that it controls the cancer very well and for an extended period of time. Many patients would respond to this drug for a period of more than 4 years. So in this particular study, we asked patients directly how they were feeling during treatment. So rather than just relying on the CT scan or a blood test, we tried to measure their quality of life, memory, concentration, other important symptoms related to a lung cancer patient, such as fatigue, cough, and shortness of breath. And the results were encouraging. Most patients reported that their overall quality of life either improved or stayed stable. Symptoms like coughing, shortness of breath, and fatigue often improved quickly, sometimes within a few days to a few weeks. So that was the first important finding that we observed. A second finding was that patients' thinking and memory remained stable over time. And that's particularly important because other drugs that treat ROS1 lung cancer have been associated with a lot of cognitive side effects, such as memory loss and so on. So the takeaway here is simple. Taletrectinib doesn't just help control the cancer, it also helps patients maintain their quality of life and often makes them feel better while they're living with the disease. For patients, that's as important as what we see on the scan.
So the cognitive part of it is really interesting because I am aware of the cognitive effects of other medications for this therapeutic area, and so that sounds like that's a really important part of what you learned from this study, right?
Yes, indeed, because we have several ROS1 drugs that are approved by the FDA, and many of them would cause things like confusion, memory loss. They do cause other neurological symptoms such as dizziness, such as lack of concentration, and so on. And these patients, many of them are relatively young, they are professionals, so they really, really need their mind. Some of them are actually, the majority of them are physically active. So symptoms like dizziness would matter a lot to them. So on top of all of that, these drugs, because they are very effective, patients could stay on them 4 years, 5 years, 6 years. So the impact on the quality of life is extremely important here. So we were pleasant to see that this drug doesn't really cause a lot of cognitive issue, doesn't cause a lot of neurological side effects. And with that means that we are preserving our patients' independence, relationships, quality of life. And that's something I believe that patients value as much as they value things like good CT reports and tumor shrinkage and so on.
Yeah, I agree. And I was going to ask you about how you define, the quality of life, and whether or not were caregivers involved with this at all, or because I know sometimes caregivers can see things in their loved ones that maybe the loved one isn't aware of. Is that something?
Absolutely, Devin. Thanks a lot for bringing that up. I learned to teach myself actually that when I'm meeting with these patients, I typically ask the spouse, "Have you noticed any change on them?" And I can tell you many times the patient themselves would say no, but then their spouse would say no. This person has become a little bit edgy. They're a little bit, not nervous or anxious, not their normal self. So 100% involving the partner or the spouse or those who are living with obviously with the consent of the patient and taking the history is extremely important in us identifying these side effects, which are critical for quality of life. Yeah.
Yeah, and I think the sponsor of this study, having the focus on PROs or patient-reported outcomes, as well as the kind of quality of life, is something that it seems like that's very forward-thinking in terms of, like you said when you started. It's not just about shrinking tumors. It's not just, and of course that's important, but the quality of life. I think that the more that I've been involved with my patient advocacy work, really understanding how important the quality of life is, because every patient's different, right? And every patient has their own lives going on, and so quality of life can be a determining factor sometimes of whether they want to be in a study.
100%, 100%. And I think the field dev overall, and again, thanks to the work of people like you, patient advocates, have helped the field move not just to focus on the scans and the numbers, the statistical numbers, and they're absolutely important. They continue to be very relevant. But on the other hand, the quality of life is extremely important. You're not trying just to give them additional months or years. You want to give them additional good months and years for them and for their families. So I think now we're seeing this increasingly adopted by more and more pharmaceutical companies. We hear again and again from from patient advocates that these parameters need to be measured in a scientific way, in a way that you could reproduce in other studies, so patients can make informed decisions. And I think when you're sitting with your patient in the clinic and trying to decide what treatment is best for them, you'll have to ask them what are their values, what really matter to them. Some would tell you, if I'm going to get a medicine that's going to make me fatigue, not be able to attend the graduation of my son or grandson, which is 3 months away. I don't want that. I don't want quantity. I want quality. So having these discussions are important. And we as physicians need to be equipped with the right data to be able to have these discussions in a meaningful way. And I hope that recent research we presented at ASCO is an addition to that field.
I 100% agree. And I think it's so important now in lung cancer. Years ago, this wasn't the case, but now the case where we do have options for different treatments, and different treatments might have different side effects and different um, quality of life issues that come to light. And so, probably for you, as knowing, well, I'm sure for you as a clinician, understanding and asking the questions of the patient to really understand what's important to them, I think, is really a key factor.
100%. I recently spoke to a patient of mine who told me I could put up with anything, I cannot put up with nausea. So again, understanding what's important, that would help you when discussing the profile of a specific side effect is critical. Yeah, and again, I think while we're also talking about the side effects, I think what's important also to note that how quickly some of the symptoms that are related to the disease can resolve very quickly once we have an effective treatment. And as I said, with this particular drug, we've seen how quickly things like chest pain, shortness of breath, cough improve quickly as well. So,
Awesome.
mm.
Well, I really appreciate you sharing your thoughts on this. It's important research, and I was honored to meet you at ASCO and saw a lot of the presentations. It was really great for me. But I just want to really thank you for your time today, and thank you for sharing your insights. It'll be very valuable to my audience. So I really appreciate it. Thanks a lot.
Thank you so much for having me. I really enjoyed this and wishing you the best, Dave. Thanks a lot.